The World Health Organization defines reproductive health as a state of complete physical, mental, and social well-being in all matters relating to the reproductive system. At this global headquarters, the criteria for a healthy society extends to safe practices, an informed sexual life, and universal access to specialized healthcare. India became the first country to operationalize these goals at a national level, launching its family planning program in 1951. This early effort, seen here at a center in Badlapur, established a state-managed framework for reproductive oversight. These national programs prioritize population control, the prevention of unwanted pregnancies, and the reduction of maternal and infant mortality rates through better clinical support. Achieving these targets relies on formal sex education for adolescents. By providing factual information on puberty, menstrual hygiene, and the prevention of STIs, the program aims to eliminate the myths and social misconceptions that contribute to teenage pregnancies and sexual abuse. Under this framework, reproductive health is managed as a critical piece of social infrastructure, where public awareness and state policy provide the necessary support for individual biological health. This biological health begins during adolescence. Between the ages of 10 and 19, the body undergoes a rapid transition driven by significant physical, emotional, and hormonal shifts. In males, puberty is marked by the deepening of the voice, the growth of facial hair, and the physiological initiation of sperm production as the reproductive system matures. Females experience breast development, a widening of the hips, and the start of the menstrual cycle, signaling that ovulation has begun. Maintaining this system requires strict menstrual hygiene. Using clean, sanitary products and adhering to a regular changing schedule are essential practices to prevent bacterial infections and preserve reproductive function. Establishing this healthy biological baseline is the necessary starting point before moving into more complex medical interventions and technological controls. The first major clinical intervention is diagnostic. Amniocentesis is a procedure used to detect genetic disorders in a developing fetus before birth. During the procedure, a needle extracts amniotic fluid from the uterus. Clinicians analyze fetal cells to identify chromosomal abnormalities. However, because this reveals the fetus's sex, it was misused for sex determination. This led to female feticide and a strict legal ban in India. This legal restriction shows how a diagnostic tool can be withdrawn from public use once its application moves from medical necessity to discriminatory social selection. Beyond diagnosis, medical science provides methods of contraception to prevent pregnancy. For any of these methods to be widely adopted, they must be highly effective, easily available, reversible, and have minimal side effects. Natural methods rely on biological timing. Periodic abstinence avoids intercourse during the fertile window, typically days 10 to 17 of the cycle. Other options include withdrawal and lactational amenorrhea. However, ovulation suppression through breastfeeding is temporary, vanishing 6 months after childbirth. Because natural methods have a high rate of human error, barrier methods are used to physically block sperm from reaching the ovum. Condoms provide a dual clinical benefit. They are the only contraceptive method that prevents pregnancy, while also providing a physical shield against sexually transmitted infections, including HIV and AIDS. For females, devices like diaphragms, cervical caps, and vaults are fitted directly over the cervix. These physical barriers are often paired with chemical spermicides, creams, foams, or jellies that kill sperm to increase the overall success rate of the method. While barrier methods are reversible and accessible, their reliance on proper placement and consistency leaves efficacy gaps, often addressed by internal medical devices. Intrauterine devices, or IUDs, are semi-permanent solutions inserted directly into the uterus by a doctor. Copper-releasing IUDs, like the CUT, emit copper ions that suppress sperm motility, reducing their ability to fertilize. In contrast, hormone-releasing IUDs like LNG-20 alter the uterine environment, making the uterus unsuitable for implantation to prevent pregnancy. Systemic control is possible through oral contraceptives. These pills use hormones to stop ovulation entirely. A notable example is Saheli, a non-steroidal oral contraceptive developed in India. It offers a once-a-week dosage with significantly fewer side effects than traditional daily pills. For those seeking a permanent solution, surgical sterilization offers a highly effective, though largely irreversible, option. This split screen shows the two procedures. In a vasectomy, the male vas deferens is cut and tied to prevent sperm from entering the semen. In a tubectomy, The female fallopian tubes are cut and tied to ensure the sperm and egg can never meet. These methods allow medical science to engineer pauses in reproduction that range from a single weekly pill to a permanent anatomical change. When pregnancies are unwanted or medically unsafe, they're addressed through medical termination of pregnancy, or MTP. This procedure is legally utilized for fetal abnormalities or when the mother's life is at risk. Safety is highly dependent on timing. MTP is safest during the first 12 weeks of pregnancy. Beyond the first trimester, unmonitored abortions carry a very high risk of infection, infertility, and death. While MTP handles intentional terminations, the system is also vulnerable to sexually transmitted infections, or STIs. These diseases spread through sexual contact, shared needles, blood transfusions, or from an infected mother to her fetus. This matrix separates STIs by their prognosis. Gonorrhea, syphilis, and chlamydiosis are fully curable in early stages. However, HIV, hepatitis B, and genital herpes are not completely curable. These require lifelong medical management. Early symptoms are often minor, like localized itching or mild pain. Females often show no symptoms. This lack of visible distress allows the infection to spread entirely undetected. Untreated STIs lead to severe complications, including pelvic inflammatory disease, stillbirths, and ectopic pregnancies, where the embryo implants outside the uterus. These infections can cause permanent damage to the reproductive tract, leading to total loss of fertility. Infertility is defined as the inability to conceive after 2 years of regular, unprotected intercourse. Although social stigma in India often targets women, clinical data shows that physical, congenital, or immunological causes for infertility can exist in either partner. To address these biological obstacles, clinicians use assisted reproductive technologies, or ART. The most prominent of these is in vitro fertilization. This process involves collecting eggs and sperm and fertilizing them in a laboratory environment, entirely outside the body. Known as the test tube baby program, this technique was a major milestone in reproductive medicine, pioneered by clinical teams like the one seen here. IVF moves the start of human life from the fallopian tube to the laboratory, allowing for the precise management of the earliest stages of development. After fertilization, the embryo is transferred back to the mother. If divided into 8 cells or fewer, it's transferred into the fallopian tube, a procedure known as ZIFT. For more than 8 cells, clinicians use intrauterine transfer, placing the embryo directly into the uterus. In cases where a patient cannot produce her own eggs, GIFT allows for the transfer of a donor's ovum into the fallopian tube. When sperm cannot penetrate the egg on their own, clinicians use ISIX. Here, a single sperm is manually injected directly into the ovum. Other methods, like artificial insemination, introduce semen directly into the reproductive tract to bypass physical blockages. While ART provides solutions, it is limited by high costs, the need for advanced instruments, and specialized medical expertise. While medical science provides these complex technological options, legal adoption remains a socially helpful and ethical alternative for those seeking to build a family.